Just a quick one about the new hospital. You must be very excited.
Yes.
What are you going to provide in the new hospital out in Elm Park or wherever it is going to be that you don't have now?
Yeah, there's two big issues. The first and the most important one is the co-location with an adult facility. So I guess when we look at the cohort of our patients coming through now, they're a little bit more complicated than years ago. Our mothers are older, more likely to have multiple pregnancies, and you're more likely to be able to get pregnant now if you have an underlying serious disease like cystic fibrosis, like a kidney transplant, like serious liver disease, like corrected heart disease, or women with uncorrected heart disease. So, and then women will have diabetes, more likely to have diabetes because they're older. So we're looking at a slightly different population, and we can prove that. We know our women are older, and we know they're more overweight, we know there are other things there. And those women require a lot of multidisciplinary care. They need a lot of extra care, not just from an obstetrician, but from doctors trained in other areas. And the best way you'll achieve that is being on site with all of that intellectual capacity and, of course, medical ability. And at the moment, we have various doctors coming to do sessions here, and we have patients going over there, and we don't have an intensive care unit. That was one of the most striking things that came out of the Oireachtas hearings, is that none of the maternity hospitals in Dublin actually have a fully fledged intensive care unit. And we need that occasionally, not very often, but we do need it occasionally. I mean, there's an amazing story, I'm sure, because it's been told in the public domain, I'm sure I can tell it, but we had a woman who had a very serious bleed from her spleen, actually, a very unusual thing, and we had the team coming from St. Vincent's, and Ireland were playing Croatia or something in Lansdowne, and so we had instruments, we had nursing staff, we had registrars, we had doctors in the traffic. Now, these people don't work for Holles Street, they owe us nothing, they have no connection. They got a phone call to say, we're in big trouble, can you help? And they dropped everything, and they came. And this woman survived against all the odds.
Fantastic.
It was an amazing story, and we're so grateful to St. Vincent's and all of that staff who just dropped everything and came to a strange hospital just on the foot of a phone call. Justin Gagan, particularly in Vincent's, I mean, amazing surgeon, but with that, you know, you can't have that. Now we will be able to pick up and say, Justin, actually just come across the corridor. It's a lot easier, and we won't be worrying about who's playing what in Lansdowne or what the fixture is. So that's, there's just one other thing as well, and that is just that we need new facility.
Yes, it's really very old. Yeah, it's sort of nice having it there, though. And I love Ivan Boland's poem about it in the...
Oh, yeah, no, absolutely, yes.
But you say no, it's not.
It's
old,
no.
And old is bad.
I say fit for purpose, modern, fantastic. I say this is an opportunity for this country to have a fantastic, state-of-the-art, top-class place to have babies. We need that. Life begins in maternity hospitals. I always say, if we deliver 1 in 8 babies in a hospital, a large part of Ireland begins in Holles Street. It should be the best.
And it's not right now.
No, it could be a lot better in terms of the facilities. It could be a lot better.